Welcome to a discussion about mental health in the workplace, brought to you by Greenspoon and Martyr and Puzzle HR. Just a couple housekeeping items. Everyone is on mute. If you have any questions, please type your questions in the Q&A, and Michael and I will address those questions as we go along the webinar, if it makes sense. Otherwise, we do have time at the end to address all questions. Also wanted to let you know that if you have more detailed questions that is associated with your business and you want to reach out to Michael or me, our contact information will be on the last slide, and you will all be getting a copy of the slides later today. So let's jump into the agenda. All right, we're going to do introductions in just a minute so you can meet Michael and me in more detail. We're going to first talk about what's the business case for talking about mental health in the workplace. Also, we're going to discuss leadership skills that will help you address these issues. Also, resources that will help you with supporting your employees. Michael, who's our attorney here, will be discussing employment laws and mental health. And then finally, we will have some time at the end to address Q&A. All right, let's introduce Michael. So I'm really pleased to introduce you to Michael Freeman. He is my partner in this presentation today. And Michael has over 20 years of experience. I've known Michael for many years because Michael was my employment attorney when I was the vice president of human resources recently, when I was at an IT consulting company leading their HR department. And I can tell you, in my 20-year career, I've worked with a lot of different employment attorneys, and I can tell you that Michael is really, really good. And what I like most about Michael is that he knows employment law, but he's also very good at taking his knowledge and applying it to the business pragmatically to solve those businesses' problems. He's really good at drilling down to the facts, looking at the risks, and then making a practical recommendation that can really fit the culture of the business. I believe his decade of experience as an in-house counsel has really helped him build this unique skill set. So Michael, please take it away.
Thank you, Lisa. I want to introduce my partner, Lisa Smith. As Lisa said, I had the opportunity to work with her in her previous role as the VP of HR. What made Lisa truly one of the better clients that I have worked with is that she was an outstanding mix of business and human resources. She understood and appreciated the human and personnel side of things and found a way to have that complement the business objectives. I have worked with a lot of HR clients who are really good at one or the other, but Lisa was great at finding a place where both could coexist. And then when you add in my legal advice on how to remedy or mitigate a certain complex situation, Lisa was always able to succinctly translate this advice to her business leaders to come up with a practical approach that usually ended up working for everyone. Back to you, Lisa.
Thanks, Michael. So on the next slide, let's look at what is mental health. I want to make sure we level set our understanding here. So it includes emotional, psychological, and social well-being. It affects how we think, how we feel, act, and it also determines how we handle stress related to others and make choices. So obviously this will impact people's work. More so in the past, but also still today, mental health has a negative stigma. We've come a long way with eliminating this unnecessary shame that many people feel, but a lot of people still worry about judgment from others, especially in the workplace. And according to the National Alliance on Mental Health and Illness, 1 in 5 adults will have or have had mental illness. So on this next slide, let's look at the effects of COVID-19. So a lot of attention has been given to mental health in the workplace in recent months because of COVID-19. And this slide shows the dramatic effect of COVID-19 on mental health. Adults have been reporting anxiety disorders and depressions pre-COVID at 11%, but that jumped dramatically to 41% after COVID. There's some other sources out there as well, including the American Psychology Association, and they've attributed this jump to the recent election, also social justice, and the division that we're seeing in the country on these issues and many other topics. Another source, KFF Health Tracking Poll, has found that 53% of adults in the United States reported that their mental health was negatively impacted due to worry and stress over the coronavirus. So on the next slide, let's look at the business case to talk about mental health in the workplace. So at Puzzle HR, we are always looking for that ROI for anything we do for our clients. So what is the business case to focus on and talk about mental health in the workplace? So first off, when people are ill, you have a higher level of turnover, and turnover is very expensive. Employees leaving your organization cost an estimate of 30% of the annual salary. And this next statistic I find really telling in a lot of different ways. So we're going to really unpack this next statistic. Half of millennials and 75% of Gen Zers had left roles in the past for mental reasons, both voluntarily and also involuntarily, compared to 34% overall, which is a lot less. So first, I think this supports my statement that mental illness does cause turnover, and turnover is expensive. And a big factor I see here is mental health issues seem to be a bigger issue for young adults rather than older generations. And I've experienced this in my work because I work with a lot of managers over the years that have been telling me that their millennial employees are so much more anxious than their older workers. I found research from the American Psychology Association to support my theory. The APA found that the percentage of young Americans experiencing certain types of mental health disorders has risen significantly over the past decade, and there's been no corresponding increase in older adults. And the study suggests a shift that may be in due part because of the rise in digital media. I actually have a client who hosts a tech addiction camp for children. Tech addiction was not an issue for my generation. And I am assuming, Michael, you're in the same camp as me, Gen X. So Gen X and us baby boomers did not have the technology attached to them that our younger generation has. And, you know, if you think about how it was when we were growing up, we had to drive to the arcade with a bunch of quarters to play Donkey Kong or Miss Pac-Man if we wanted any kind of technology in our lives. And that wasn't an attachment to our body like our kids have today. This data also is important because we see how the mental health awareness is generational. So think for just a second, think about your leadership team. Imagine how old you think they are, what generation you think that they're in. And I would venture to guess that it's likely that they're not part of that millennial or Gen Z category based on years of experience. Most of your top leaders are probably over 38 years old, which is the oldest of the millennials. Therefore, having this business case in your back pocket to shine a light on this issue is probably needed to get mental health in the workplace the attention that it deserves. Let's look at some other costs of mental health to our businesses. Employees struggling with mental health have diminished job performance, productivity. A combination of factors such as anxiety and lack of sleep make it hard to remain focused and productive. Employees struggle with relationships with coworkers, with clients. There's more absenteeism, and oh, by the way, there's some real dollars associated with absenteeism. There's an estimated cost of $1,685 per employee per year. That's an estimated cost. Multiply that times all your employees. That's quite a bit of money. Other issues include, changes in appearance like lack of hygiene. Also, employees have trouble with problem solving and focusing. They seem easily confused. It's hard for them to learn new tasks, and they may take longer to finish those tasks. So finally, employees struggling with mental health also withdraw from the team, which also impacts team collaboration. So let's go to the next slide and talk about some of the leadership skills that we can work on our teams in our workplaces to help combat mental health in the workplace. So we've talked about the business case. Now let's turn our attention to these leadership skills. So emotional intelligence is your ability to recognize and understand emotions in yourself and others, and your ability to use this awareness to manage your behavior and relationships. And this book called Emotional Intelligence 2.0 is a great resource for leaders who want to better handle mental health in the workplace. It includes a self-assessment that tells you where you are with your skill set in emotional intelligence, where you have some gaps, and then there's some tools there to help you improve your emotional intelligence so you can better handle mental health in the workplace. And building emotional intelligence is so important to us at Puzzle HR that our team is reading this book as a team, and our CEO is providing some training for us. All right, let's move on to some other leadership skills that can help us in the workplace. So another piece of another skill in your toolkit to manage mental health in the workplace is empathy. So on the next slide, you'll see that empathy is on here, and empathy is your ability to perceive and relate to the thoughts, the emotions, or experience of others. And those with high levels of empathy are really skilled at understanding a situation from another person's perspective and reacting with compassion. And in the workplace, this simply means that your people are able to establish true empathetic connections with one another that enhance relationships and performance. And according to the 2020 State of Workplace Empathy study by an organization called Business Solver, there's a big disconnect between what employees see and leadership sees regarding empathy at their particular workplace. 91%, almost all of CEOs, believe that their company is empathetic. But if you look at where the employees stand on this, they're saying 68% of them agree with the CEO. So going back to that turnover issue, another piece of the study found that 75% of employees would choose an empathetic employer over more money. There's also some recent research that's coming out. I'm seeing a ton of this. One is from an organization called Silk Road Technology, and they did a study that found 2 in 5 office workers plan to look for a new job based on how their employer handled the pandemic. And then also another article from the Society of Human Resources Management suggests that a quarter of workers plan to quit their jobs once the COVID-19 pandemic is behind us. And finally, there is another study, Prudential's Pulse of American Workers survey, says that 1 in 3 employees don't want to work for an employer that requires them to be on site full time. So the reason I'm bringing this up is because having skilled leaders that can be empathetic, that can show emotional intelligence is critical, especially now as employees are considering leaving their workplaces. And we're finding with our clients are opening back up. There's tons of recruiting going on, and they certainly don't want to lose their great employees because people are feeling like it's not a great place to work. Also, leaders who show strong emotional intelligence and empathy skills attract and retain this top talent, just like I said. So we've got to teach our leaders how to have these skills so that we don't lose our strong talent. Also, strong leaders communicate more. They hold town halls and more one-to-one meetings with employees. And I also think it's critical to teach our leaders how to hold these meetings. What do you discuss? How do you discuss it? What topics need to be covered? What is the agenda? What's the objective? Because if you just have these meetings, it just is a waste of time if you don't have a clear objective. These leaders need to learn to listen and learn and think about the world from the other person's perspective. Teach our leaders to ask their staff, how are you feeling today? How are things? And also, thinking about the virtual aspect of this. When everybody was in the office, it was pretty easy to see if somebody was off, and you could pull them aside and say, hey, is everything okay? But now if we're totally virtual, or even in the hybrid, or just coming back, it's harder to do, and we need to be more deliberate as leaders to focus on our employees and check in with them periodically. Also, another really important factor here is that it has to be authentic. It is more damaging to just be mechanical about this and not truly care than to not ask at all. And when leaders ask these questions, they need to do something to help. We'll talk in a minute about some resources that are out there for leaders and employees as well. Strong leaders show compassion to people when they disclose a loss. So we need to spend time and be deliberate to teach our leaders how to have high emotional intelligence, how to have better empathy. And I believe that these skills can be taught to our leaders. Going to the next slide, let's also look at some more actions that our leaders can take. Surveying your employees anonymously can provide the organization with the employee data to really build the mental health initiatives that match the needs of the organizations. Don't assume you as a leader know what's best. You need to ask your employees what they need. Leadership teams need to build a strong culture to support their employees. Having healthy competition is fantastic in the workplace, but think about this. Does your culture pin employees against one another? Does your organization provide flexibility to allow employees to take the time to care for themselves, to care for their families? Or does your culture recognize and reward leaders and employees who create a healthy work environment? Or does your organization do the opposite? Again, managers talking to employees and encouraging peers to have conversations with coworkers is important. Those coworkers need to be trained too. The Gallup organization has done years of extensive research pointing to companies with employees who have what they call a best friend at work, meaning they've got a trusted coworker in the workplace. They're better performing companies. And so managers need to foster that kind of culture within their organization. Managers also need to manage burnout. According to a 2021 research report from Mental Health America, employees who are burnout care less for their coworkers and also care less for their clients. They're also very cynical, and they have trouble focusing and performing. And burnout also leads to depression. Managers need to monitor the workloads and adjust them when needed, and encourage employees to take time off, and also model the way. If your manager isn't taking breaks or is working unnecessarily during their vacation, this is not a great model for their employees. A new study just released from Stanford University on Zoom fatigue found that constant virtual interactions are causing exhaustion, and it's impacting women more than men. So 1 in 7 women compared to 1 in 20 men felt extremely fatigued from being on Zoom all day. I'm guilty of this, and I bet many of you are as well. Looking at myself instead of looking at the other person when we're on Zoom is very fatiguing. And women, especially, many people, especially women, can be very critical of ourselves, and seeing ourselves constantly all day and having that internal criticism is causing stress. So some solutions that we have found include moving further away from that screen, or shrinking the video app window on your computer. Or here's a cool tip. If you go to that top corner of your video, there's 3 little dots. You can click on that and you hit hide self view, and you don't see yourself on video. Companies are also encouraging to have 1 day a week where there's no video. We're not doing video, so it's just 1 day a week of no video. We've also talked about companies creating a strong peer-to-peer relationships, that Gallup organization saying that these strong relationships are important within the organization. So organizations also need to educate their employees on mental health in the workplace. And once an employee is aware of the signs and sees a fellow employee in distress, they need to know how to react. They need to know how to encourage and how to be a sounding board and where to go for help. So speaking of help, let's go to this next slide and we'll talk about some resources here. So there is a ton out there. There's even more that's on this slide and there's a lot here. So I'm going to just quickly go through this and just hit some high points and talk about some of the resources that are out there for us in the mental health space. Puzzle HR does work with our clients to design a program that best meets the needs of our clients' employee population, as well as their budget. And we've managed small budgets and large budgets. So please contact me if you want more information on any of these resources. So the one that's probably most popular and people may have heard of is the Employee Assistance Program, the EAP. But even the EAP has evolved in the last year. So an EAP is a work-based intervention program. It's designed to help employees with resolving personal problems that might be adversely affecting them at work. And this benefit usually provides to employees whether they take healthcare insurance or not. EAPs assist workers with things like substance abuse, counseling, child and elder care, financial and legal challenges. So I personally adopted a child a few years ago and had my EAP research adoption agencies for me, and it saved me a lot of time and a lot of stress. So talk to your broker if you're interested in providing an EAP option for your employees. And because many times it is part of your health insurance. If not, Puzzle HR does have a great vendor we work with, and we have discounted rates for our clients. Some of our clients, the way they've expanded the EAP is to offer the EAP to anyone living in the household, not just the employees. One employer I know of is working with their employees to provide 20 counseling sessions through their EAP. So that's an increased number that is typically offered. One company is also offering digital counseling sessions through their EAP. But I'll tell you, the EAP is still a really underutilized resource for employees. A lot of employees don't really know or understand the benefit, but Puzzle HR often assists our clients with promoting awareness and communication to their employees about their EAP. So wellness programs, much of what we're talking about here is kind of bundled up into a wellness program. But I do want to call out that if your healthcare benefits are self-insured, many carriers will provide funds, quite a bit of funds, to your company, as well as a wellness resource, a person on their team who will be an advocate and help design some of these programs for you. They'll even provide funding for prizes for some of these challenges, like a fitness challenge, a steps challenge. So check with your broker if that's of interest to you. Psychologists on retainer and well-being coaches. So one of my clients has a psychologist on retainer that all employees know and have access to. They even have that psychologist in their building they own. They gave them a discount on the space so that they're right there for their employees. And they make it a requirement for their executives to at least have one session a month with the psychologist. Of course, it's anonymous and confidential, but they find that that's beneficial for their leadership team to be healthy. It was really beneficial to them recently because unfortunately they had a death that was very unexpected of an employee on their team. And that psychologist was able to jump in and help people with the grieving process. Some clients that I've seen do have well-being coaches that offer sessions for employees to talk about anything that's causing them stress. The next is stipends and lifestyle flex accounts. And some monthly wellness stipends or lifetime flex accounts are employer provided funds for health and wellness products and services. And this is different than an HSA or an FSA because it is a taxable benefit versus being pre-taxed. And there's different things that are reimbursed, like gym memberships and race registration, athletic wear, counseling for nutrition. Those types of things are covered. And then some other unique stipends that I've seen clients, or excuse me, employers provide include a travel stipend. They put money away for the employees to take a vacation. And I saw one company provided a $2,000 stipend a year for their employees to go on vacation. So that was pretty cool. There's lots and lots and lots of webinars, articles, and chat channels out there. One example is having a Slack channel for people in the company to have discussions around mental illness. And it just encourages employees to reach out when they need help. Apps and websites, there's just too many to even mention, but just a couple examples. Modern Health is a platform, and it includes an assessment for employees to see where they are from a well-being perspective, and then it provides coaches and stress management. There's lots of meditation apps like Calm, Headspace. There's also sleep health apps out there like Daylight. Wellbeats is a virtual fitness class. Thriving Minds includes articles and webinars targeted for wellness. There's an app called Sibley, which provides a lot of, will provide a text with just a quick information around different topics. And then finally, I'll talk a little bit about, or not finally, but Mindful Mondays. Let's talk about that. So it can be any day of the week, of course, but Monday is the start of the week. So a lot of companies will want to start activities that have a calming tone for the week. So an example might be, set aside a time where everybody goes on a nature walk, either if you're in the office or at the plant, or if people are at home, set that time aside. I've also been reading about doctors prescribing what they call vitamin N, and that N is for nature. So many studies are showing that being out in nature causes a very calming effect and causes someone to be less anxious and depressed. And then finally, there's the financial impact. We all know that finances cause stress in people's lives. And so there's one organization I would recommend you Google. It's very cool. It's called Community Impact Fund. And what they do is they are focusing on financial scarcity by leveraging technology to anonymously meet the needs of employees' financial needs. So let's say somebody is, has their water heater go out and they have no savings for that. They can post that anonymously and the company can jump in and give, or other employees can jump in and give. And then there's also resources to help employees start saving so that they have a savings account for those emergencies. Then there's also assisted student loan repayment programs. So much financial debt of students coming out of college. And the CARES Act that was passed in March of 2020 also got an update recently. It is allowing employers to temporarily provide tax-free dollars to employees up to $5,250 a year. And they can contribute this money towards student loans or tuition assistance. So for years, employers have been able to help with tuition assistance, but this is new because now they can give money towards those student loans at a pre-tax benefit as well. So that's my wellness engagement. Michael, do you see any questions so far?
I don't see any questions from our participants. I did have one though.
Okay.
The emotional intelligence and empathy, I've always understood it to be either you have it or you don't have it. Mm-hmm. But from hearing your presentation, it sounds like this could be something that if I don't have it, I can learn it. Is that fair? And have you seen success with some people that are maybe starting off with as less empathetic or having a lower emotional intelligence and being able to learn how to be an empathetic leader?
Yes, I have a great success story, and I do believe people are probably born a certain way and more likely to be more empathetic than others. However, I do think it's a skill that can be developed and honed. I have an example of, I used to work with an organization in their IT department, and there was an IT director who was having problems with retention. And we were learning through doing an analysis that some of it was due to employees not feeling appreciated. And so he would joke with me that, he grew up in a household that, hey, I told you I loved you the day I married you. What's your problem? And so he struggled with this. So we went through and talked about how he could make this a part of his weekly routine. So every Friday he would block out an hour and he would sit and he would write down what different people on his team had done that had gone above and beyond in some way. And then he would spend about 15 minutes walking around the floor and going up to people and telling them what he had written down. And, it was uncomfortable for him at first, but it was authentic because he wrote it down and it was really true in how he felt. But once he started getting into the habit of that, it got to be more natural and it got to be more appreciated. And it really did turn things around within his team, because then people started feeling more appreciated, because we all as human beings want to feel appreciated.
Great, thank you.
Thank you.
So if we can go to the next slide. Here comes the legal part of the presentation, and I would encourage all the participants out there, to the extent you have questions, a reminder, please ask them in the Q&A prompt on the bottom of your screen. But the mental health and the ADA, basic rules. Under the ADA, a lot of employers only really think of a physical disability or impairment as something that is covered, but mental impairment is part of a disability as defined under the ADA. And if somebody has a disability, whether it's an employee or an applicant, an employer must reasonably accommodate this employee or applicant, unless, and there's the buzzwords here, doing so would create an undue hardship or would directly threat the health or safety of the organization. Additionally, how do you define qualified? So a qualified employee or a qualified applicant, if they have the requisite education, skills, experience, able to perform the essential functions of the job. And once again, this is with or without a reasonable accommodation. So if after giving somebody a reasonable accommodation, the employee or the applicant can perform the essential functions of the job, then they are deemed qualified, and you would, as an employer, have a difficult time arguing that they cannot do their job successfully or efficiently. Let's go to the next slide. Under the ADA, the major task that employers many times forget to do or don't do as well as we'd like them to do, if and when it becomes litigious, is engaging in the interactive process. So when do you start the interactive process? The obvious one is when you know that there's a disability, whether you know about it or you think you know about it or somebody brings it to your attention. At that point in time, you have reasonable knowledge or apparent knowledge that that individual has a disability, and then you have a proactive, affirmative obligation to begin the interactive process. If the employee comes to you with a doctor's note saying, here is my disability, whether it's a physical or mental one, then at that point, you also have an obligation to engage in the interactive process. If somebody asks for or requests an accommodation, if they've been out on FML leave, and because they've been out on FML leave due to a physical or mental disability, then that would, once they return, you probably should sit down with them and say, okay, now that you're back, do you need a reasonable accommodation to perform the essential functions of your job? And then finally, if a third party sees something or believes they see something and brings it to your attention as HR, management, leadership, at that point in time, you probably have an obligation to engage in the interactive process. Question I get a lot of times is, can we as the employer ask for medical information? I've heard about HIPAA, I've heard about confidentiality. Can I go and ask the employee for any sort of medical information? Because they just asked me they just told me they have this disability, or they told me they need an accommodation. are my hands tied, or do I automatically have to grant them whatever they asked? And the answer is, yeah, you can ask them for the medical information, but you need to be somewhat cautious and mindful when you do that. Here's a few bullets as to what you can actually ask for. So you want to know what the nature and the duration of the restriction. How long will they have this disability, this impairment? You're not asking them what the underlying diagnosis is, but you can ask them legally what it is and how long the accommodation or the disability will need to be what kind of limitations they have. So you want to ask the physician or the mental health provider, in your opinion, what type of limitations does this employee need to perform their job? That's a fair question. And I should back up too. A lot of companies have some type of form or template that they will give their employee to provide to their doctor or their mental health provider to fill out and answer some of these questions. So if you have this in advance, that's helpful. If not, you are completely fair game to ask these questions on a one-off basis. You can ask the doc or the mental health provider whether they believe the employee actually needs some type of accommodation, and if so, what they believe would be a reasonable one. Doesn't mean that when they say it, you have to abide by that particular accommodation, but getting some guidance from the provider is always a helpful start in the process. And then finally, you can ask the healthcare provider what their qualifications are. I've had many clients and been in a lot of situations where we certainly believed or had reason to believe that employee who was not the most trustworthy person had their buddy down the street fix or create some type of letter and used creatively some template or letterhead that had a doctor's office on it with some made up credentials and asked and wrote a letter for this particular employee to either not work or only work the shifts that he or she wanted to work. So you can go back and ask the healthcare provider for their qualifications, and hopefully they are what they say they are. Let's go to the next slide. Interactive process, once again, and we're focusing a lot on this because this is probably the most important part of complying with the ADA, and this is where I see a lot of my clients run into some issues later on. If the employee says that you discriminated against me based on my disability, it's usually as a result of not following all of these processes under the interactive process or any of these things here. So number one is, what is the job? So in order for you to know whether the employee can perform the essential functions of the job, it's probably a good idea to start with what is he or she actually doing on a day-to-day basis. And the two places that you probably can get this information from is, number one, the job description. Do you have a written job description? And hopefully you are doing somewhat of a biannual review or audit of your job descriptions to make sure that what is actually on paper is consistent with what the employee is doing on a day-to-day basis. And to that point, the second one is watching or observing what the employee does in their actual job. And if you are not the frontline supervisor, then go into the frontline supervisor or somebody in HR to say, okay, I'm not exactly sure what Joey or Janie does on a day-to-day basis. Can you write it up for me? Can you give me an idea of what it looks like? Because I need to know whether we can accommodate a certain type of accommodation. Next, confer with the employee, just so you're not A, bidding against yourself and B, shooting in the dark. Ask the employee what they think their limitations are and what they think they need from you to be able to perform the job. Many times it's going to be a lot less than what you are drudging up or the mental exercise that you're going through to try to put yourself in their shoes or their mind as to what they're looking for. So if you actually talk to them and have some sort of collaborative process, then more often than not, you'll be surprised where they're not asking for the moon, the star, and the suns. They just want the moon or the star or the suns, but not all three. And you're able to come up with some type of accommodation that works for everybody. And then you want to, once again, go back to ask the healthcare provider, ask the employee whether the accommodations are reasonable or not, and ask them for suggestions. And then you as the employer are the one that gets to determine or not whether the accommodation that they are asking for is reasonable. And just because they ask for it does not mean automatically that it's reasonable. If you have some type of issue with the accommodation and you can articulate why it causes an undue hardship on the company, that can be something to push back on. So you can always come back with some type of counter accommodation, whereas, hey, you wanted to work different hours during the day. You asked, instead of doing the 9 to 5, you wanted to move it from 8 to 4. Can't do that because we don't open up until 8:30, but happy to move you from to 8:30 to 4:30. Would that work for you? And doing it that way, so you don't automatically have to rubber stamp their suggestion. And then finally, pick one. So whatever it is that you decide is reasonable, and after going back and forth with the employee to get their input, pick one and then document your decision and explain why you picked that one. I always recommend that after you come up with a final decision, you put it in an email, you put it in some type of, you memorialize it. So if and when this becomes litigious or adversarial down the road, you have some piece of paper to say, here's what we decided, here's what we communicated to the employee, and here's the rationale or explanation as to why we came up with this decision. All right, any questions out there yet?
Not yet. I have some, but I'll wait till the end to make sure we don't have others.
Another question I get very often is, okay, we implemented this accommodation and it's not the most comfortable thing for us as the employer. Don't love it, but we get that maybe it's reasonable, but how long do we have to do it? Can we do it for a week? Can we do it for a month? Can we set some sort of timeline on this as to when we can stop this accommodation? And the answer is, there's a lot of answers, but number one is you do it until the employee says they no longer need it. Where if they were on some type of medication and the doctor has taken them off the medication, where now they're able to get up in the morning at their normal wake up time, as opposed to the medicine made them groggy and they slept in for a couple more hours, you can now push their start time back to when it used to be. If they come back to you, the employee comes back and says, okay, I'm good, I no longer need that accommodation, I think I'm fine at this point, then that is okay to end the accommodation. If it becomes an undue hardship, if you've tried it and you reasonably tried to accommodate the employee and you did it for a month, 2 months, and you say, you know what, we've lost 3 or 4 people quit over this, or our revenue has gone down, or our metrics, how we're measuring the productivity of our team has tanked, we can't continue to do this way, that at that point in time would be a reason to end the accommodation, or at least to re-engage with the employee about the accommodation. If the employee fails to cooperate, if you've adjusted their reporting time or location and all of a sudden they stop showing up for work or go to the different location, or whatever the accommodation may be, they do not uphold their end, at that point in time, you can end the accommodation. Then finally, if there is a mental health issue and the employee becomes violent or threatens some type of safety issue, automatically at that point, you can end the accommodation. And I'm always an advocate of, I'd rather be safe and wrong than legally right, but have some type of risk. And obviously the better way is to be legally correct and safe for our employees and our work staff. But I'm always a very conservative when it comes to making sure that everybody at the workplace is safe. And if there is some sort of threat, then it's always a smart move to pull back and see where things stand and make sure that you can continue to provide the accommodation the employee is asking for.
And Michael, we do have a question, if you don't mind pausing for a minute for it.
I don't mind. Let's do it.
Okay, so what are you seeing as far as anxiety with employees returning to the office after COVID? Are there things companies can do to alleviate these concerns?
Yeah, really good question. And we are seeing some of that. And I'm, as you can imagine, talking to a lot of clients this week about what their policies are going to be as it relates to masks or no masks. And now that the CDC has changed its guidance on whether you have to wear a mask indoors if you're fully vaccinated, and whether the non-vaccinated people want to come back, or even the vaccinated people want to come back, wearing a mask, not wearing a mask, if not everybody is vaccinated, whether they want to return to work and they have that high anxiety. So we are seeing that. And I think a lot of people, employees, got comfortable being home, and there is the fear or the anxiousness of returning to work. So what we're recommending is, not even from a legal perspective per se, but more from a communications and HR personnel, is reaching out to your employees and making sure that they're aware of, here are the steps that we're taking to ensure that we have a safe workplace. And we are aware of your concerns, and here's how we're going to address those, because you're not alone, and other people also have those same concerns. And we're being very proactive. We're making, we're still implementing some of those social distancing measures, or we're making sure that if you are returning to the office, that you are vaccinated plus 14 days, or things of that sort, to make sure that they're A, being heard, and B, that you are addressing the concerns and being more proactive with the return to work program.
All right, well, we got another question that sparked some interest in the vaccine. Can a company require employees to get a vaccine and/or show proof of a vaccine?
So I don't want to take us too far off course on the vaccination, but it's certainly a hot topic, so happy to address it. Yes, you can require, yes, you can mandate employees to get a vaccine in most states. There's some bills in process, and I think Montana, if I'm correct, is one state right now that just came out with a law that said you can't discriminate or treat vaccinated versus non-vaccinated employees differently. So there is some, this is a moving target, but you can require the vaccination. You can't, if somebody comes to you and says, I don't want to get vaccinated, and here's the reason why, and it's for religious reasons or disability reasons, then you can't take some type of adverse treatment against them. You need to engage in the interactive process, accommodate them, and see if there's some type of way to get them comfortable with the vaccine or not, and provide them with an alternate work location or way to perform their job. And then finally, showing proof of the vaccine. You can ask employees to show proof of whether or not they were vaccinated, but to the extent that they don't have or have not gotten the vaccine, you can't ask them why. So you can't probe and say, okay, well, you did not give me any sort of the card or upload that you affirmatively that you were vaccinated. I got to know why. And that right there, you're kind of calling them out on whether it's an ADA issue, a religious issue, a medical issue, things of that sort. You can't ask them that follow-up question, but you can ask them initially to show that they have in fact been vaccinated.
So we're getting this question a ton as well. And so we're recommending to use the carrot more than the stick, because you have to think through, what if people refuse? Are you going to fire them? Because really that's the only thing you can do if you're going to actually have this mandate and have it be a requirement to work at your employer. So we try to find ways to incentivize employees to get the vaccine versus making it a mandate, unless you're in some sort of healthcare field or something like that. We also are getting the information out to employees, like what you said, telling employees what they're doing to make sure it's a safe environment. And then we've even had employers ask employees who has been vaccinated, and then send out some statistics like 75% of the workforce is vaccinated. So we're in a good place as a company if that's the case. So we're trying to do that kind of communication and make it more of the carrot versus the stick.
Yeah, and I've had conversations just this week, once again, with clients who are asking about incentive programs. It's not an anomaly where a lot of companies are saying if you have not been vaccinated, then we'll pay you $50, $100, or whatever it is to get the vaccine. And before they do that, what I've been advising some clients or employers is you may want to take like a poll. So where are people at this point? Are in the three camps? I've already been vaccinated because I was first in line as soon as it became available. I was really anxious to get my vaccine, or there's no way on earth that I'm ever planning to get this vaccine because for whatever reason I don't want to. And then there's a bunch that are in the middle on the fence of I'm undecided. I waver back and forth. Should I or shouldn't I do it? And I think the incentive programs, based on the feedback that I've gotten from clients and the research I've done, that will help that middle group, I think, push them over the edge to get vaccinated. You're probably not going to convince the ones that are adamantly opposed to it, but the ones that are in the middle, I think if you offer them some type of incentive, then it arguably could help them change their mind. But okay, so shifting back to the mental health webinar and our examples of accommodation. So here are some. This is obviously not an exhaustive list, but here are some more popular examples of what a reasonable accommodation could look like. I don't get along with my boss, and every time I see him or her, I get very anxious, depressed. I want to be reassigned or transferred to a different boss or to a different location. If you have the capacity to do that and you actually have an opening in a different building or team, then that could be considered a reasonable accommodation. I don't want to come into the office. To the earlier question, I have a lot of anxiety about returning, or I just don't like to be around people, and I'd rather be at home. Can I do that? And that's another example of an accommodation. But the caveat there is I'm getting a lot of questions about if I say no to that, has the pandemic changed how companies think on this one? And the short answer is yes. So if employees have successfully worked remotely or from home for the past 12, 18 months, it's going to be harder, not impossible, but harder for you to say as the employer, I need you in the office to successfully perform the essential functions of your job. And there's some jobs that absolutely need to be there, need to have the eye contact, need to be in person, need to be answering phones, need to be available for those meetings. But there's an extra hoop to jump through now to be able to do that. Leave of absence, if somebody has a serious health condition, if there's they come to you and say, I'm abusing alcohol or drugs, I need to check myself into some type of rehab clinic, then that would be a reasonable accommodation, and you should let them take whether it's inpatient or outpatient, take the time to get themselves better. I need more time to perform my job, so you're telling me I need to do make X number of phone calls within a given shift, and because of my disability, I'm unable to do it as fast as my peers. So you modify the target number there, and instead of making 20 phone calls for a 3-hour shift, we'll tell you hit your numbers if you make 15 phone calls. And then the other one, the flexible hours, where I can't get up in time, or I need to work later because of a certain disability. That's something that we see quite often as well. Legal takeaways. So if the foot stomping here is, here are the things that I would recommend that everybody do to make sure that if and when you are faced with some type of ADA or disability challenge, that you have the documents to hit the ground running. As we talked about, job descriptions, making sure that your employees are actually performing the jobs as they're described in your job descriptions, and if they're not, update those. So make sure that, especially now in the post-pandemic world, I'd be willing to bet, and I know this, after talking with a lot of my clients, that jobs have modified, jobs have changed, and a lot of employees are not necessarily doing the same exact things that they were pre-pandemic. So if you have the capacity, or if you need help on that, that's something I know that Puzzle HR and we could help you with too, to update your job descriptions. What are your policies for handling requests? Is it in your handbook? Is it in your, have you communicated to your employees as to what they should do if they do need to request some type of accommodation? Or if they have a disability, who do they notify and how do they notify them? Let your team know what to do. And if somebody comes to them with a request for an accommodation or letting them know that they have a disability, and if your leadership team or management or HR doesn't know that at that point, certain things should happen, the interactive process, you should train, you should engage with them and go back and forth, then that could be a pretty catastrophic thing in the long run. Medical records, if you get the medical records, if they're providing them to you, how do you handle those? They should not be in the same folder as the personnel records. So you want to make sure that you have two separate folders, one for medical records, another one for personnel records. And if you conflate or mix those, that could be problematic down the road too. And then finally, I'm sure you've heard this from attorneys all over the place, but document. You can't have more than enough every time you have a conversation with an employee, every time you make decisions that relate to what you are doing or how you're going to handle some of these requests. Make sure you document those, memorialize them, because me as the attorney after the fact, I would love to have those records to be able to show that the employee was on notice, the employee was engaged in the process, the employee was collaborative and participated in whatever decisions were made. And that that will put you in a much better position than you would be without that records.
All right, well, we have another question. So is there documented data that shows how men are negatively impacted emotionally as opposed to women with returning to the workplace? I don't have any data around that other than, what I shared earlier about Zoom fatigue being impacting women more. Also early on in the pandemic, there were a lot more women falling out of the workplace versus men to care for all the issues, the kids at home and all that stuff. But I haven't seen any research around that. Have you, Michael, about return?
I have not.
Yeah. Okay. Well, we have just 1 minute left. Let me see if we have any other questions. No, I don't see any other questions right now.
And if you go to the next slide, if you do come up with questions, this is how you can get a hold of Lisa and myself. Emails, phone numbers, cell phone. So please feel free to reach out and ask whatever questions you may have after the fact.
Yes. Well, thank you everyone for joining us today.
Thank you.